So I'm here with Cobb's neurologist today, Dr. Akin. She's agreed to come over and answer some questions that we get a lot on Cobb's Facebook page. Some of the questions are repetitive and I hear them all the time. Other questions are new questions I've never heard before. And I thought, you hear explanations from me all the time. I'm constantly talking about, answering all the questions that come up all the time, but I thought it would be really nice to hear it from Dr. Akin herself, Cobb's veterinary neurologist. So Dr. Akin, can you introduce yourself?
Sure. I'm Dr. Akin. I first met Cobb in 2017. Hard to believe. It's been almost 5 years. I've been doing only neurology, veterinary neurology for 14 years. So I did my training at Auburn and moved here about 6 years ago and have been meeting really cool patients like Cobb ever since.
So when you first saw Cobb, he came in, he was brought in, I think the rescue stepped up and brought him in. What do you remember about that?
I remember he came in through the emergency department, which is in our building, and then he was transferred to my company or my clinic, which is a neurology clinic. And I can't recall if you were involved then or if there was another person from the rescue. But what I remember is a dog that was completely paralyzed that I had some concerns about. He had an unknown medical history. He was essentially found on the side of the road. And I knew we had to do some digging essentially to figure out what was wrong and to see, one, if it was something that was fixable, or two, the extent of whatever his injury was.
Mm-hmm. And so at that point, I think he had an MRI, right?
He did. So he had an MRI. The rescue really was invested in Cobb and wanted to know what was going on. And so he underwent anesthesia that day, had an MRI, and we were able to determine what the problem was. He had a significant contusion or a bruise in his spinal cord. It was at the level of the T11, T12 intervertebral disc. He also had some, to kind of describe it simply, kind of changes in his muscle on the MRI, which suggested potentially some sort of trauma. One of the possibilities was what we call a traumatic myositis, or injured muscle from a trauma. And then
and that could mean like a hit by a car.
Hit by a car, okay. Fell off a curb, who knows, any of those things. And the other thing that I remember was that his back legs weren't super scrawny, but there was some muscle atrophy, which suggested to me that this had probably been going on for a little while. So I don't think he had necessarily been hit by a car right before the Good Samaritan found him. Mm-hmm. But I think there may have, one, been some trauma at some point, and then two, there was some chronicity there. This had been going on for a little while based on my exam.
Okay. Wow. I didn't even know that. Wow. What made it the fact that he wasn't a surgical candidate? Some dogs, I get asked all the time, well, wouldn't surgery fix him if it was a spinal cord? Because people think of it as a disc thing.
Right. And that's a good question. In his case, and I'll back up. In general terms, we're usually doing spinal surgery to decompress the spinal cord, meaning something is pushing on it, whether it's a slip disc, whether there is maybe a fracture, there's a severe injury from a trauma, and the spinal cord has something pushing onto it. In his case, there was nothing compressive. There was still spinal cord, there was no pressure on it, but there was this bruise in the spinal cord, and you can't do a surgery on a bruise. I compare it to, like, if I'm walking around in my kitchen and I hit my hip on the corner of a table, it's either going to get better or it's not. There's no surgery per se to fix this bruise. With skin and muscle and things, usually gets better. The spinal cord, nervous system, not as forgiving sometimes.
Right. Okay. That makes sense. I didn't even realize when he came in that his spinal cord injury was something that probably happened prior.
I think
this
so.
Wasn't a fresh injury. I had no idea. That's interesting. With his specific spinal cord injury, I get this question a lot too. Why does this cause him to have an inability to control his bowel and bladder?
So essentially, the communication between the brain and the hind end, the peeing and the pooping, is disrupted by this injury. That's why he can't walk normally. That's why he doesn't urinate normally. That's why he doesn't defecate normally. So essentially, it's just a disruption in communication. So he still makes urine, he's drinking, he's eating, he's still doing all those things, but his brain doesn't recognize, hey, my bladder's full, I need to empty it. And then in addition to that, if somehow he could feel that sensation and know, he doesn't have the communication to say, hey, bladder muscle squeeze, hey, sphincter muscle relax, so that I can let the urine leave my body. So it stays. And that's why you have to express his bladder. That's why he
Right.
wears a belly band and occasionally leaks.
Okay. And then another question I often get, and I could probably answer this one, is why? Well, how does he go poo then? And does he know to go poo? That is something that happens involuntarily, and that's going to
Correct.
happen whether or not, that really doesn't have anything to do with his spinal cord injury, because it's going to happen when it's going to happen.
Right. Obviously there's pathways, and if his spinal cord was normal or uninjured, he would know when he had to poop. He would let you know when he needed to go outside. He can't do that. And so I tell different clients, I work with a lot of dogs with back injuries, that I say, not to be crude, but if you're eating and things are going in, things are going to come out. And so for most dogs, if the feces is normal and formed and, not diarrhea, it's not the end of the world. It's easy to clean up. It's, and you can actually usually get a lot of these patients in a similar situation on a schedule.
I have him on a very good, having worked with paralyzed patients, I have him on a bowel program too. So I don't even literally never have accidents around the house. Once in a while, he'll bark out a nugget or something. We call it barking out, like he's a little piss dispenser. But, very rarely do we ever have accidents, because I stimulate him to go twice a day.
Right.
So, so he's good to go. We don't have those problems ever. One of the things I get a lot, and maybe you can just kind of address this the way that you would talk to a patient. Sometimes people, I know they mean well, but they kind of imply that we have sort of given up on Cobb because we don't continue therapy. He's been discharged from rehab, two separate cycles he's done. And, the reason he was discharged is because his therapist felt that he's made all the progress he's going to make. So we've accepted that. We completely understand that, but people want us to keep doing, you keep doing this, keep doing this, keep doing this. Can you just explain how I can do it till the cows come home, but there's just not, he's never going to be able-bodied again.
Right. So I think in his case, I love the fact that you went to rehab, and, and I'm assuming you still do some exercises at home and things. And I would encourage that just for muscle memory, muscle mass, all of those things. But the reality is unfortunately with some nervous system injuries, in his case, a spinal cord injury, they aren't reversible. They're just not, they're not fixable. Consequently, there's not going to be an intervention, whether it's surgery, whether it's more rehab, whether it's some secret medication. There's not going to be a true treatment for his issue. And that's just the harsh reality of some severe spinal cord injuries. Yeah,
that's thank you for being so honest, and I'm glad you shared that. Can you one of his followers specifically asked me if you could describe what spinal walking is.
So spinal walking is interesting. It's you can imagine generating gait or generating the ability to walk in a normal pet or person. It's very complex. What spinal walking is, it's kind of a muscle memory phenomenon, but it's also a phenomenon of certain cells and certain pathways in the spinal cord called central pattern generators. So even though the communication between Cobb's brain and back legs is not there, his brain can't say, hey, walk normally, keep your balance, etc. There are these pattern generators that make these movements that are like stepping. So that's why when you see a dog that's paralyzed, that can't feel his feet, that spinal walks, you do see movement in the legs, but it is involuntary. He doesn't necessarily know. And if you watch Cobb or another dog like him walk, the front legs and the back legs aren't doing the same thing.
Right.
The back legs are very spastic. They're all over the place. And some dogs, there's enough functionality. They can kind of get around. And I've seen Cobb do that. I know he does. But it's not true voluntary movement, meaning Cobb is not thinking, okay, I'm going to walk normally. It is truly a reflexive type activity.
Okay. And then something else that came up recently is somebody was holding him up and he started bicycling his back legs. And they were like, he's not paralyzed. He's moving his legs. He's moving his legs. And I'm like, no, he's paralyzed. That's reflexive movement. Those
Correct.
are things that are happening. He's not making them happen. Just kind of like what you were just saying. It's all reflex. Same thing like when I put my finger between his toe pads and he kicks.
Mhm.
It's
That's
all
a reflex.
reflex. It's essentially, I equate it to the doctor checking your reflexes.
It's
in your
exactly
knee.
the same thing as that. It really is.
Okay.
It's truly a reflex. What you're seeing is called a withdrawal reflex. So if you pinch between a dog or cat's toes, the reflexive movement is to draw the leg away. So you have flexion of the ankle and the knee.
Okay.
And so it is the exact same thing as the kneecap reflex.
Okay, that's interesting. And then, do you have anything else to add?
Just regarding the spinal walking, it's a really interesting phenomenon. And, you know, most pets that spinal walk also have a cart or, you know,
Yeah.
some sort of wheelchair to help them out because it's not going to be enough to help them walk normally.
Right.
But I do think that it should be encouraged because the same reason why you would recommend physical therapy or rehab, it just encourages muscle mass movement because with muscle, if you don't use it, you're going to lose it.
Right.
And so what we're trying to do with Cobb is just minimize the muscle atrophy, keep as much muscle mass on those back legs, excuse me, to keep him healthy as long as possible.
Okay. And then for my final question, people will often ask me, will Cobb have a normal lifespan?
I think he will. So to me, the things that you have to watch out for in a pet with his type of injury, does he have special needs? Yes. You know them, you take care of them. Things you'll have to watch out for are, you know, does he ever scrape his legs when he's walking? And you guys watch that because you can get infections secondary to wounds and things like that. And the other big thing is making sure you empty the bladder, because if you leave urine in there, it can pool. You can get UTIs, which can spread. But in terms of him living a normal, I'm going to call him a schnauzer lifespan, have a poo, I know. Lifespan, you know, to me, yes, as long as he is well taken care of, which you and your family do.
Right.
And I anticipate that he'll live a long, healthy life.
Well, I'm happy to say he has not had a UTI in 3 years.
Yay.
3 years. So I am very proud of that. We've come up with a lot of different strategies and I've finally figured out how to not have a UTI anymore. Paul, can you bring Cobb over here? So he's going to be in the video.
Yeah.
For the last part.
Come here, handsome buddy.
Yes, okay.
There's a handsome boy.
And this is the boy that we're talking about right here, Cobb. Cobb is a paralyzed Havapu, and he is about to turn 6 years old on Thursday.
Oh, well, happy
This
birthday.
Thursday,
I didn't know it was
yeah.
that soon.
This
Happy
Thursday.
birthday, buddy. You're so handsome.
Thank you for doing this, Dr. Akin.
You're so welcome. My pleasure.